brachial plexus begins in the posterior triangle of the neck. The roots pass between the anterior and middle scalene muscles and extend to the axilla. The roots of the plexus are the ventral rami from C5 to T1. They form a superior, middle, and inferior trunk. We have an anterior division shown in yellow that contains the lateral and medial cord, and a posterior division in brown that contains the posterior cord. Terminal branches of the lateral cord are the musculocutaneous and median nerve. Terminal branches of the medial cord are the ulnar and median nerve, and terminal branches of the posterior cord are the axillary and radial nerve. The musculocutaneous branch of the lateral cord exits the axilla by piercing the coracobrachialis and descends between the biceps brachii and the brachialis. It innervates the flexor muscles of the anterior compartment of the arm, which include the coracobrachialis, the biceps brachii, and the brachialis. The axillary branch of the posterior cord passes through the quadrangular space and wraps around the surgical head of the humerus deep to the deltoid. It innervates the glenohumeral joint, the teres minor, the deltoid, and the skin of the superolateral arm. The radial branch of the posterior cord passes posterior to the humerus in the radial groove between the lateral and medial heads of the triceps. It innervates the extensor muscles of the posterior compartment of the arm, which include the triceps brachii and the aconius muscle. It also innervates the skin of the posterior and infralateral arm. Here's a summary table of the terminal branches of the brachial plexus. We'll see the median and the ulnar branches in future dissections, and we'll also see how the musculocutaneous, radial, and axillary branches have contributions to the forearm and the hand. Thus far, we've discussed the important terminal branches of the brachial plexus. However, there are many other branches from the plexus that are important to know. Make sure you know these branches and what they innervate within the axilla and arm. Damage to the brachial plexus can cause loss of muscle movement and cutaneous sensation. Erb's palsy occurs when there's a lesion in the superior part of the plexus at root C5 to C7. It occurs when there's excessive stretching between the neck and the shoulder. It clinically presents as an adducted shoulder with an extended elbow and loss of cutaneous sensation on the lateral aspect of the arm. Klumpke paralysis is less common. It occurs when there's an inferior lesion in the plexus at root C8 or T1. It occurs when there's an excessive superior pull on the arm and clinically presents as the claw hand.